She walked up and they lost their minds. They were like, damn. It's in their job description.
I think I'm a very bad veterinarian.
No.
Oh my God.
I'm not going to go for the chunks.
I cannot drink coffee.
I don't feel safe drinking out of this. It feels wrong.
And we're sitting on the couch and I hear howling, like deep guttural howling. And then I hear it again. And I'm like, what is going on? And then I hear a thud.
Hello, everyone, and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode or a previous episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, let us know.
All righty. Hammer home
for the first
Oh, I was going to say, where'd it go?
Wow. I love it.
Yeah, it's a little mallet.
Wow.
That'd be a gavel.
If you're
That's the word I was looking
if you're
for.
I
listening,
knew you were
we
looking
got
for
a
it.
new gavel like what judges use.
Yes.
Yes.
And this is our hammer.
It's a little more
Hammer
high-pitched.
home.
Yeah.
Yes. So reviews, guys, we kind of blew it out of the water this week.
Yeah. Holy cow.
Spotify, previously 271, we're at 276.
That's a big
5.
jump. That's
Yeah.
a big
Thank you
jump.
all. That's like one per
Thank you.
weekday.
Thank you.
And then we're at the same on Apple Podcasts, 115, but it's still progress.
Yeah,
And
it
very
is
exciting.
progress.
Absolutely.
It's still a lot of reviews. Like if you combine them, that's
It's
a lot of reviews.
reviews.
A lot,
Yes.
a lot of people saying stuff.
Yeah. No kidding.
And
So-
Devin, we finished the pie video.
Yes,
High
we
five.
did.
How
Yep.
did it go, guys?
It
Talk
was-
about what you did. Just
it was
recap
fun.
it again.
Okay. We got up on Wednesday
Oh my
morning.
Okay, maybe faster than
No,
that.
so we went to Lynn Hall at the small animal hospital. We walked in and there was a gentleman he was kind of like monitoring the hall.
Yeah.
And he's like, "Can I help you ladies with something?" And she started to explain that we're from the Veterinary Roundtable. And he's like, "Oh, I know. I've seen you guys." We're like, "Okay."
How did that feel? Did you feel like celebrities?
I think it was more towards her, but it was sweet. And we asked where we could find some students. So he directed us to the common area.
Cafe thing.
Yes,
Mhm.
and there
Yeah.
was a group of gals sitting at a table studying, and we were like, "Hey guys!" She walked up, and they lost their minds. They were like,
It was really funny.
Immediately
We walked
recognized
past
her.
them to go to the cafe first because
Yeah.
we're like, okay, they looked like they were working on
Yeah.
something.
"Too studious."
So we walked into the cafe. And those people really looked like they were
Yeah.
working on something. So then
Like
we turned around. We were
headphones.
like, okay, we don't want to bother them. So then we
Yeah.
turned around and went back. And then that's when we stopped them and said,
Mhm.
hey, I'm Dr. King and we need some people for a video. And they were like, oh.
Yes.
It was
They were very
great.
excited.
So
Yeah.
all the nursing students at
Mhm.
Purdue,
They
it
were
was
all there, they're
fantastic.
nursing
Thanks for
students.
helping us.
Mhm.
That's awesome.
Yeah.
The video should come out this week, so stay tuned. I'm excited to see it. I have not
I'm
seen
excited too.
Yeah.
Yeah,
I am
me too. I haven't seen it either. But yeah, Devin, you're a great sport.
it. Thanks.
Can we get
It was
can we
fun.
have a spoiler?
I keep
Oh.
thinking about it, and I regret not finding an opportunity to pie you in the face.
Oh.
Like the
You
last-
should have
like a
totally done it.
surprise.
I would have.
know.
I would have been up for it.
It would have been so funny. Like the last girl that like kind of
Yeah.
hesitated. That's when we should have done the ultimatum with the 2, and I just boom.
Yeah, you should have.
But it's okay. Next time.
Yeah, she could have gotten me.
Did
Next
anybody get it
time we
right or
have-
wrong?
did
They
you know
all
all
got
the-
it right.
No wrong answers?
One girl got it wrong, but like before anyone could even say anything, she corrected it.
Darn.
So
Yeah.
Too smart.
Yep.
Wow.
They did great. It was fun. It was a great time.
Can't wait to see it. We're
Mhm.
excited,
Yes.
just like all you listeners.
Yes.
And
This fun.
follow us to watch the video at the Veterinary Roundtable on Instagram and TikTok.
Boop,
Yep.
boop, boop.
I'm
I'm Dr. Emily King.
Oh my jinx.
Jinx. What are we supposed to do?
Oh,
You
I
owe
don't
me a
know.
Coke?
Okay.
You owe somebody Coke?
Jinx Poke,
Yeah,
you owe
okay.
me a Coke. I don't
I've
know.
I
never
don't know
heard
what it
that.
is. Okay.
Anyway, back to it.
Who are you?
Dr. Emily King.
I'm Courtney Allen.
I'm Devin Fortune.
I'm Dr. Ashlyn Duckwall.
And today
today
is a very
is-
special episode because it's our
our
100th
I did it the wrong way.
It's our 100th episode.
Yeah.
episode. Roundtable.
There's lots of confetti for all you people.
Oh,
100.
I love it.
Wow, I did
Or
mine
you
the
could
wrong
be the
way.
one. We'll each be a 0. You be an exclamation point.
We should have got fake.
Let's do it.
No, it would be an exclamation.
Oh
We should've
my
brought fake
god.
$100 bills.
Oh, made it rain, baby.
Made it rain.
Oh, well.
Because we don't have real ones. We just have to
Yes.
get fake ones.
Yes. Just a little cheesy. Thank you for listening to us for 100 episodes and keeping us going.
We'll keep the content
It's
coming.
crazy. For you
Yes.
two that have been with it from the beginning, is it crazy that it's 100 episodes?
I feel like it should be more.
I don't know what episode I joined
I'll be
at,
honest.
but
I mean, when you look back, you're right there.
I think she
Fighting
needs some
cops.
water.
Did you follow the confetti?
We need
Swallow the
some
confetti?
water.
Just keep
Harrison?
talking without her.
Harrison?
Okay, so yeah, you need a water,
Moving on.
or you can
I'm
just.
fine.
Okay.
It's been going on for
Okay.
2 weeks. I'm good.
we'll watch
But
it
yes,
in a
100
second.
episodes, that's crazy. But I
Yeah.
agree with you. I mean, I haven't been on it as long, but I feel like it should be more.
Yeah.
Yeah.
I mean, it's like when you think back to the old studio too. On top of it's like,
I
oh
know.
wow,
When it
I know.
was-
It's been years. Like,
Are
we've been
we-
doing it for years.
Are we
So
including when it was like 2 boys in a business or 5 boys in a business
no,
or something?
that was before. Yep.
I guess now that we're doing it weekly, obviously we'll hit 200 faster, and maybe
Yes.
that'll feel more appropriate.
Right.
You know?
Oh, yeah, because it's been spread over.
Yeah.
Yeah, because it
so
was
long.
2 a
Yeah.
month. It was just 2 a month.
Mhm.
Yeah.
It was once a
It's
month for a
crazy.
while.
Yeah.
And you guys
Now
just
we're
round robin the clinic.
Yeah, we would just be like, "Who wants to be on it?" And we'd like beg people and go pull people.
Beg
and
people.
Pretty much.
Here we are now.
Yeah.
And then we never knew what you were getting every episode.
Yeah.
It'd be like good, bad, ugly. I don't know.
Yeah. Yep. Exactly.
Well, that's crazy.
Um,
Okay.
Okay. Are we gonna announce this?
Okay, we
Next
have,
order,
we
I
have
need
a
the
very
water.
big
She needs
announcement,
water,
folks.
Next
okay.
order of business.
Not only is it the 100th episode, but we got a big announcement.
We
We're, like really big. Big doesn't describe the announcement.
Guys, what are you doing in January?
Specifically, January 27th.
Yeah, it's a Monday.
It's a Monday
We
evening.
will be in Orlando,
7 to 10
Florida
p.m.
Woo woo woo!
for the VMX
we going to
conference.
Florida.
But
The-
not
But-
only.
Uh-huh.
The Veterinary Roundtable will have a live episode at VMX in Orlando, Florida
Uh-huh.
on Monday, January 27th, 2025 at Ole Red.
Yes. Super exciting. The show will be emceed by Dr. Molly Brinkman.
Everyone
which is
loves Molly.
Really exciting. Who doesn't
Yes.
love Dr. Molly?
I know,
Dr.
it's
Molly
going to be
said-
awesome.
Nobody.
It's going to be funny, entertaining, all the things. And if you want to know what time it is, it's from 7 to 10 p.m. So take a nap, take some coffee, and it will consist of a live shortened podcast episode, a game show, partying, and networking.
Yeah.
Mhm.
Once again, it is at Ole Red. Putting that out there.
There are going to be veterinary themed drinks. There's going to be 2 free drinks per ticket.
Which is a
2.
deal.
Which
Two.
is
It's a
ridiculous.
And a
deal.
ticket is
When you hear the
$4.99.
price of the ticket, it's
Well-
redunculous.
We're not there yet, Devin.
Sorry, I'm just
There's going to be
excited.
food, exclusive VRT merch, which I'm very excited
I'm
about,
so excited.
Mhm.
and crazy
Yeah.
prizes like $1,000 gift cards. Whoa!
Yeah, I
It's
know,
crazy.
right?
That's insane.
Free drinks and prizes.
I mean, come
I mean,
on.
it's
And you get to
Wait
Yes,
till you
but-
hear the price of the tickets. you
yes,
guys.
wait,
Yes,
it's
we're-
coming.
yes.
It's coming. Okay, so
doesn't get
get your
much better than that.
tickets now by
Right now.
clicking the link in this episode's show notes or by visiting our social media pages and clicking the link in our bio. Tickets
Get
are ready and go
ready.
fast, so take advantage of the early bird pricing, which is $4.99.
Oh, 99.
That is
get
just
them
crazy.
now.
Or
That's
that's
$5
Not even
for 2
$5.
free drinks. You have to pay for the
entertainment.
games.
That's what
Yeah.
I'm talking about.
Entertainment.
$4.99 for entertainment
And
doesn't
gift-
happen.
Gifts.
And
You're
gift-
gonna
And
maybe get a
donating
prize.
to a nonprofit.
Yeah.
Yep,
And you get to meet cool people.
yep. Now
Yeah, it's gonna be kind
that's
of a big
crazy.
deal.
it's going to be awesome. It's going to be very exciting. When I saw the big screens with the thing on it,
Yes. We've been
I was
preparing
like,
for this
"Holy
for a while.
cannolis! This is
Mhm.
crazy! Like,
Like
this
it's
is gonna
real.
be-
It's real life. We've been
Yes.
It's been in the works for a very long time. Where it's like it's happening.
it's happening.
Yeah.
So to warm us up for the whole
Mhm.
veterinary themed drinks thing,
Yes.
and with it being the 100th episode, we went to Flash from the past
Mm-hmm.
and made ourselves some drinks, baby.
So if you're listening right now, if you're in the car, it's okay, but maybe later. But if you're listening, go over to our YouTube
Highly
channel, the
recommend it.
Veterinary Roundtable, and hop on our video so you can watch and you can see our drinks.
Because we've just
cute
upped
little
our game
drinkies.
from the last time.
Yeah.
Yeah, we
Yes.
did.
Like, I mean, it's worth looking
it's
at.
It
just
sure
pretty much for
is.
presentation. I mean, taste I hope is good too, but our presentation.
We should
Yeah.
give
Yeah. I know about-
backstory of how
Okay.
we got to these choices,
Okay.
right?
Yes.
Yeah.
Okay, so we basically put topics of vet med in a hat and we
Mhm.
just picked them out.
Yes.
And based off what we got, we had to make a fun drink out of it.
Mhm.
So seriously, you guys should look and see what some of these look like because
They're so
I don't know if
They're
I want to
awesome.
drink some of them.
Yeah.
Okay. All right. So do you guys want me to hand you mine first?
Yes.
Yeah,
You go
yours
All
is
right.
melting.
So mine is.
Don't say what it is. We have
Don't
to
say what
guess.
it is.
No.
Okay.
Are we
supposed
guess?
Are we supposed to guess still?
Yeah, let's guess.
I'm sure we can guess.
Okay.
Just
well, I
describe
mean,
what it
We're
looks
being
like.
photographed.
pass down.
Okay.
There's one.
Oh,
Okay,
it's so
pass it down.
pretty.
It is really pretty.
Pass it down.
I like
It looks
these
very
glasses.
minty.
Pass it
I
down.
know. I was gonna say there's
I'm,
blue.
really
What do I
excited,
do?
You have to stir it.
What's
Go ahead.
nibble
Oh.
chocolate?
Go ahead and stir it.
This is
All the
bite.
way completely?
Yeah, just stir it up, and then so that it all
Wait, we need
mixes.
to describe this drink.
Have you
okay.
tasted it?
Okay, so this is a
Okay,
drink that
so
has
it looks-
ice in it.
It looks like a milkshake, honestly.
Okay.
A light blue milkshake
That would
with
work.
some dark blue, like,
Food coloring?
yeah, but in swirls and pretty swirls
Okay.
with some whipped cream and chocolate.
Okay.
Shall we all take
I
a...
have no idea if it's going to taste good. Duckwall's sucking it down.
Oh my
Okay.
gosh.
That
it's
tastes
so
like
good.
mint chocolate
I
chip
knew
ice
it was-
cream
I knew-
melted.
Mm.
I literally knew it was going to taste like that.
Yeah, it's good. It tastes like mint
Maybe
chocolate.
ask what beverages are in here.
It was like,
There was also chocolate bits on top, and now they're gone.
so do you want to know? Guess what it is? Can you guess?
Chlorhex.
I said...
Oh God, no, that's
Oh,
great.
no.
I should have done. I
Yeah,
could have done
it
that
looks-
for
that's
sure.
what I
there are
thought,
some blue
chlorhexidine.
chlorhexes. I said it looks like Fatal Plus, but I know that probably wasn't an option.
Fatal Plus.
It tastes alcohol.
Wait, let us think.
It's too blue. I put too much in, but I was too worried that it wouldn't go to
Dawn
a
dish
slight
soap?
shade.
Diff quick.
Dawn
No, oh, Diff Quick would have been
Dawn
good
dish
too.
soap.
You won't
No,
get.
don't tell us yet. Give us one more shot. It's too.
Anybody else have
It's
gifts?
too blue.
You didn't guess.
If you thought the chocolate bits that were on top, the chocolate
Stop,
chunks
let us
on top
think.
would be pieces of
I want a piece of chocolate. Now it's
a
at the
poop,
bottom.
a poop.
What?
Pieces of
what
poop.
something that would surround that you would
Mucus?
give,
Fabric? Is it like a
that you
foreign
would give
object?
a dog when
An
you're
enema?
No,
Denamarin's blue.
other direction.
Not Serenia. Sucralfate?
No,
Sucralfate's pink.
and you would take an X-ray of
Barium?
it. Barium.
Barium's blue?
No, that's what I said. I put too
Oh,
much-
what? Hello? How are we supposed to get there?
Barium's white, King.
I know.
Here, look at her color. Drink.
Listen,
Nothing
it's fluorescent. When it goes in the GI tract, you take a picture of it.
Oh, no.
It's opaque.
Okay, it's really good.
It's really delicious.
But you could have literally straight up made a white
Okay,
drink.
listen, I did. I put it all white in there, and then I was like, I need it to be like, like barium is like just slightly off.
It's
white.
not. It's like pure white.
Very white.
Okay, well,
It's delicious though.
all right. So
It does smell like berry.
Do you want to taste it?
berry-ish.
Since you didn't taste
Right?
it.
Oh no, I
doesn't
tasted it
taste
before.
Oh,
I
okay.
made it. Yeah,
Okay.
No, it smells like it, I thought. Doesn't barium smell like
Oh,
berry?
you just said
Barium
that-
smells like yogurt.
You just said
it
that this smells
depends
like
on what
berry
flavor because
Oh,
it has
oh,
like
no,
cherry
barium.
flavor, barium. They
I
have
want a
like
piece of
different flavor
chocolate.
berries.
I'm just
I need a
saying, now's the
spoon.
time. But I once had a patient lap up the barium from the bowl, and it was the best
So
day
did
of my
I.
life.
Occasionally that will happen.
That's
Yeah,
happened to me.
If they're
Yeah.
My
Okay,
chocolate
so
corn.
I put a little too much blue dye in. I'm sorry.
That's okay.
It still
It's
tastes
delicious.
I don't know
delicious.
what my
Okay.
chocolate is.
I
but
do
want a
like the
piece.
Chlorhex.
it's
Those-
quite
There's spoons up
heavy.
Where is
It is. It's
spoons up
cream.
there.
So-
it's because it's all whipped
Did you
cream,
hear me?
whole milk.
You're not gonna get it because I've been trying.
It's like
Oh, I'm gonna
Fine.
stop there then.
Yeah.
This whole
yes, it is. It's yeah.
Really?
It is.
wouldn't melt
If you
its
froze it, it would be a milkshake. Okay.
I want a piece of chocolate.
I don't know where the chocolate went.
Okay, it's delicious.
Okay. Good.
It
I'm
is
glad
delicious.
you like it. Okay.
I would rate it a 10 out of 10.
Wow.
Thanks for taste.
Okay. Thanks.
I've never had a minty alcoholic beverage before. Well, I've had
I just had the confetti with chocolate.
what's that one? I don't know what it's called, but that's good.
Okay,
Mint
well, I'm
chocolate
glad
chip
you
ice
guys
cream
like
is my
Is there
favorite.
peppermint vodka in there?
Yeah.
Rumplemint,
It
Rumpel, whatever.
is. It is
Is
a
it
white
peppermint
Russian, a peppermint
Svedka?
white Russian.
That's
Peppermint White Russian.
delicious.
I
Wow.
have
Well,
made...
I mean, you sure made up for what it's supposed to look like.
I could have just left it all without any blue in it
It is
at
yummy.
all.
Oh my god.
Yeah.
That makes it
That's
pretty
okay.
And...
But when I tried mine, I just put one drop in of my
Wait,
blue,
so
and it
what's the-
looked this great color.
What's the chocolate for?
It's a poop.
Who doesn't like chocolate
Who
anyway?
doesn't like a chocolate? Yeah,
Ooh.
exactly. Okay.
I think it was delicious.
It was.
all right,
It is
Courtney,
delicious.
tell us yours.
Okay, so mine is in a.
There are 5.
There's one for Harrison.
Oh, how
You
kind.
want me to pass them around, pass them up again?
Yeah. So mine is in a specimen jar. It has a blue lid. It's a clear jar, and the liquid inside is yellow, and there is a strip on top.
Should we dip the strip in there?
If you'd like. So does anybody
These
have
are
any
non-used-
guesses? It's really hard, right?
Have these been used?
Is
No,
this
I'm just
urine for urinalysis?
Yes.
kidding. So yours is a urinalysis?
Yes.
I love it.
I love it.
Mix them.
Do I need to mix
Put your
it?
cap and just mix it
Stir,
around.
swirl it.
No,
Swirl
not
it.
the entire square, just like top layer.
I'm doing this.
Yeah,
What
do
is
that.
that?
That's fine.
Wait,
Okay.
It's not carbonated.
Sip.
Or you can do a really big shot if you'd like. Whatever.
Oh, that's good.
Okay,
Oh,
genuine
that's
question.
delicious.
That's delicious.
I thought it was going to be pure orange juice, and I was like, oh,
Yeah.
boy. Is it?
This is
No.
pineapple juice or some
Pineapple and
sort.
orange
Coconut.
juice and vodka
Yum.
and Malibu
It's like a
and
pina colada.
amaretto.
That's really
Wow.
and amaretto.
There's
Ooh,
a
that's where
name
that
to
flavor
this
comes
drink, and I can't remember what it is. but-
Courtney, do you think we can go down and name what each?
Probably. Did you taste yours?
Yeah, it's delicious.
Oh, okay.
Oh man, that's good.
Oh.
This is refreshing. This
It
would
is.
be a nice
I wonder
lake
if we could.
day
No, I found
on
it.
ice drink.
Yeah, I found the recipe I found from a guy that lives in Alabama.
I was
and
gonna
he
say, is it
out on his
Alabama
boat.
Slammer?
This is
Yes,
really yummy.
that's what it is.
Is
It's
it
a slammer or something.
Mm,
Yeah.
Alabama Slammer.
really
Yeah,
yummy.
slightly
I don't know if
frozen.
that's true or not. Harrison can
Mhm.
tell us if that's accurate.
That's a good one.
accurate.
I almost just drank all of it. I'm going to save
Harrison,
it.
do you want to taste yours? You don't have to.
No, I'll wait.
Guys, if I'm being completely honest, I think we're gonna go from best taste to worst taste because I can't guarantee how mine.
Did you taste yours first?
No, well, I tasted it this morning at like 6:30 a.m.
Oh wow. Okay, yeah.
because I had to make it and make
Did
sure
it
that
stay
it was good.
in the fridge, hopefully?
Yeah, it did.
Okay, God.
My hands are
But just because of some of the things that are in there, I can't guarantee how yummy it is.
Oh, gosh. Oh,
Okay,
I'm already
let's
scared.
do it,
All
do
right,
it.
let's just do it.
Let's do
Let's
it.
just
Hand
do
it out, Devin. Hand it out. Let's go.
You know, we can always wash it down with mine at the end.
There we go.
So.
Thanks.
We need.
So
Where's that
mine-
popcorn?
I don't feel safe drinking out of this. It feels
Mine-
wrong.
Oh
allow
wow,
me.
it's
So
leaking
it's-
out the side. Oh, that's
It's
like
not.
I need gloves to
Okay,
drink
let her
this.
explain it
It
to all
is-
the
it's
listeners.
a fecal tube with a brown liquid in it, and if you shake it, there's little chunks that float around.
It is leaking.
Why is yours leaking?
I need a napkin.
Oh my God, I feel like I'm on Fear Factor.
Mine's not leaking.
Chunks in it.
I know, guys. I think
Very
it's
scary.
condensation because they
What?
were in the fridge. I think it's condensation.
But it's,
Okay.
it's brown tinged.
Okay, that's fair
Okay.
enough. Okay,
Well-
so it's a fecal container. We have brown liquid with floaties.
Yes,
It's a diarrhea fecal sample.
Okay, so we're asking.
Giardia.
Yeah. What do we guess? We're guessing what it is.
Yeah,
Parvo poop.
Yeah, parvo.
Clostridium.
Giardia, coccidiosis.
Diarrhea.
it's just a fecal float.
Okay.
That's a nasty fecal
I was-
float.
That is a good
I was gonna fill it
representation.
to the top and put a cover slip on, but that would be messy.
I will say though, this
that
is
would
what
be so clever.
this is what horse fecal floats look like because you have to mash them up.
That's
Ugh.
crazy.
So, it's an espresso martini with Oreo bits.
That's
so.
Can you imagine if you would put slides on the top of this? This would be
I
hilarious.
know, but it would
Cover
be
slips.
such a mess.
It would be a mess. I totally agree.
It has.
I'm doing it. I'm not gonna think about it.
You're taking a sip. Wait, what is it?
I
An
can't
espresso
guarantee how good it
martini?
is.
It tastes like coffee.
I got a chunk down the throat.
Oh my god,
I'm not gonna go for the chunks.
I cannot drink coffee.
When we're describing,
Oh yeah, she doesn't like coffee.
know you don't.
Uh,
I know
Are you
don't like
okay?
coffee.
oh yeah, it's
She
good.
hates coffee.
you just never been a coffee person.
I
huh?
cannot do coffee.
So are you like
Guys,
a Coke
I'll have you know.
person? Are you like what's your
I can drink
caffeine-
Coke.
What's your caffeine choice? She-
I don't know.
My
Well,
hands are sticky.
y'all are
Guys,
gonna.
I
hate
brewed
mine.
this espresso.
I'd say tea.
That's
I
really
like
Like
good.
an
tea.
actual espresso.
I like
that
the taste
brewed.
of it. That was
Honestly, Devin,
Thank you.
seriously, 10 out of 10 for presentation.
Thank you.
It
Totally.
seriously- You seriously
If I
killed
liked
it.
coffee, I would like that.
Yeah.
Let's be real. Any
Does it have
vet,
alcohol in it?
No, because it tastes like coffee, like legit.
Yeah.
It is.
any vet med drink should make you cringe a little when you're drinking it. I'm
How
just
much?
saying.
How much? What is like? How much coffee did? How'd you make it?
So I have a bartender as a sister. So I texted her. I'm
Oh.
like, okay, what are the ingredients? What are the proportions? So one serving is 2 ounces of vodka, 1 ounce espresso, 1 ounce Kahlua or Bailey's. So I doubled that. And then I added a tiny bit more espresso
stuff.
because it was really strong.
Nice.
Yeah.
We'll be up all night.
And then I
Yeah.
just added in the Oreos so they didn't get super good.
Okay, I like it.
Nobody say anything.
Okay, don't say anything. Okay, got it.
Thank you.
I don't know about this one.
I think
it's
this
gonna
is
be-
amazing.
I feel like
think
you
it's
used
gonna
these
be
cute
so
little cups
strong.
last time. Did you use the cute cups out?
I
You
did
didn't.
not.
They're
I
so
did not.
cute.
But thank you.
This is
Okay,
so cute.
so this I have here a shot glass, and in it is just a clear base liquid, but the
Girl.
main shebang on top
So
is a syringe filled with reddish tinge liquid, and a vaccine.
It's so cute.
A homemade vaccine label.
You killed the vaccine label.
Yeah, the vaccine, that looks amazing.
Store at 72 degrees Celsius?
Oh, everyone has a different number. Everyone can read out their number.
72 degrees Celsius is like
Mine says 100 degrees
Fahrenheit.
Celsius.
Mine says 24.
Hold on, I got to read mine.
Yours might be the most accurate.
Mine is definitely the most
Store at
accurate.
69 degrees Celsius.
These would be very bad vaccines.
I love my batch number. My batch number.
Yeah,
Okay.
batch number was random. I don't really have anything
It's really
to that.
cute though.
3-year injectable.
Also,
I love it.
I said a company on there, and then I was like, maybe I shouldn't have put a company. So I put VRT on the side, 3-year injectable rabies. Everyone has a 3-year. Nobody freak out.
Incredible
it's 3-year.
work.
Okay.
You killed the vaccine sticker.
3 times
Holy
as potent.
crap.
Don't you know that about the 3?
Rabies vaccine. Zoom in on that one, Harrison.
Okay. Woo, woo, woo. Look how cute that is.
Okay, now
Can we
Don't
inject it in
stab
there?
yourself.
everyone
Wait, now
has
we have
to. No. You have to put it in your drink.
I
Okay.
was going to take it off in my mouth, but
Okay.
I'm
Now,
scared.
because it's a shot, down the hatch, ladies.
It
Let's
stings.
go.
Oh no.
Down the hatch. You have to. It's a shot so you can get vaccinated.
So you can get
Did you
Everyone is getting. This is part of the plan. Everyone needs to take at least a sip. I won't
did you
make you take
aspirate
Oh.
before injecting?
I can't recap my needle.
Did
Oh,
everyone?
God.
Okay, we're
One-handed
having
method.
struggles on giving the vaccine over there. We can't recap. the
Cheers to the 100th episode.
She poked through the skin.
Cheers to the 100th episode. Cheers, 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 cheers.
I'm scared.
All
Down
right.
the
Do
hatch.
well with hard alcohol.
Okay, now wait.
Oh,
You big rabies vaccine.
Oh, thank you. Thank you. Thank you.
Vaccinated. Rabies vaccinated.
Wow. Duckwall just handed out vaccine tags.
I feel
There-
like I have rabies.
Good job.
I'm pretty sure someone has a cork one. I need these back, by the way. These are my animals.
Oh, darn.
These are their rabies tags.
Technically, this is from 2021,
oh, that's an
so-
old Frank one. Then you can have it if you want.
so it only lasts for another month or two.
Wow, that was
Oh,
we
gosh,
killed
guys,
that.
this was awesome. Way to go.
Wow.
This was impressive.
It was great.
That was
Very
fun. I feel like we
impressive.
could end it there. It was super fun.
I know, right? Yeah, exactly.
Yeah, I think that's good. Bye, guys.
Just kidding. Apparently, we have to keep going.
Okay.
I think that's a good peak for everyone.
I think
don't
that's the
know.
peak.
Yeah.
I mean, let's.
Do we even want to damper it with
Nope.
kids? Can we just move on?
I think we move on to inquiries.
I think we make an executive decision.
Girl, you did it on purpose. Every time I give you side eye, I'm like,
I just got to make sure you're listening.
Do you like it?
It's so good.
How would you rank each drink in terms of taste and presentation?
Ooh.
I can't get over those vaccine stickers. I am blown away by those.
The
Thanks,
vaccine
guys.
stickers are
a lot
are
of
pretty
work was put into
legit.
that.
Yeah.
Oh my
that
God.
that was work.
Yeah.
I did it when my baby was napping.
So do we give her
I
the,
say, yeah.
And she brought rabies tags. So I
And-
think she
yeah.
takes first press for presentation.
Presentation
The
for
work.
sure.
Yes, because I think I
Yep.
was like almost last time.
Yes.
So.
Yes,
I
you
think
were.
that's fantastic. You
Thank
were
you.
last. Yeah, hers
Yeah.
was bad last
Yeah.
Yeah,
time.
it was bad.
It
Oh
was.
my
It
God.
didn't even taste
It
good.
was part
No,
of
it was so
bad.
bad. Yeah.
Yes, I have redeemed myself.
Yes.
And this is the one I originally picked out of the hat and I didn't want to do because the second one I picked out was chlorhexidine. So then I was like, I'll do rabies.
Yeah,
Yes.
I got propofol.
No.
I would say taste wise, Courtney's.
Yeah, 100%.
It was so refreshing.
I don't know. I think Devin's presentation, if you make it look like what it's supposed to be,
That is it.
that's it. And I don't want to drink it because of how it looks.
Yeah.
And that's like,
That's true. That's true.
pretty legit.
That's pretty legit.
Thanks, guys.
So
My sample is very concentrated.
honestly, a little bit hazy. Maybe a UTI situation
turbid.
or
Turbid. Yeah.
something else going on in
That's
there.
a good word. Turbid.
Proteinuria. I don't know.
Harrison, can I please have a water?
Devin's drunk.
There's just a lot of different alcohols, and they don't mix very well.
Are you okay?
I'm okay.
Oh, it's okay. You're a new 21-year-old.
I'm not drunk. It's just
You'll get
nasty. I drank vodka, and then I drank that. And
I had
then
vodka?
drank coffee, and then mint.
I had vodka.
And you had vodka, and she had.
Do you need some
A
food?
lot.
I mean, if there is.
I brought yogurt and fruit
Oh,
for you
thank
guys
you.
again,
It's
but I
a
forgot to tell you
She's a
before we
cheap
started.
date.
I haven't eaten since like 11 this morning. I
There's
actually
popcorn
worked
in there,
today,
too.
guys.
Oh. Well, yeah,
Okay.
you need a snack. Okay.
Okay. Anyway.
All right.
So
We're
no
skip
pits and
this.
peaks.
I mean, I do, but if we want to carry on, I don't care.
Oh. Okay.
Oh,
You
well,
guys
go for
share?
it.
Yeah,
I don't know.
Share.
I don't care.
Share.
You go.
My peak
This is so good.
is that I successfully completed all the content of semester 3 of my school.
Wow, go Devin.
Good job.
I have one more semester 4, so it's kind of crazy. I have not enrolled yet because my pit is that at the beginning of this semester, they were like, oh, you need 15 live webinar hours. And I, being myself, was like, oh, I'll do that later. And then I get to this last unit and they're like, reminder, you need these 15 hours. So I'm done with all the content, but I still have like 3 hours of webinars to watch this week.
Ooh.
So I don't get attendance for them until Friday. And then I can conclude semester 3 and enroll in semester 4. But there's no more like quizzes or tests or studying
Okay, that's
I have
amazing.
to do
Mhm.
for this semester.
That's
So,
amazing.
That's
yeah,
amazing.
I'm excited.
Good job.
That's
Thanks.
very
Well done.
exciting.
One
You're
more.
ahead, right? Technically.
Oh, yeah.
Good for
Oh,
you.
yeah.
Fast track was 3 years, and I'm like almost 2 years in.
Oh my god.
Yep.
I'm
You,
excited.
girl.
Think.
Hammer it out.
Yep,
Hammer
you
it
can do
out.
it. All those
Almost there.
listening, you can
Absolutely.
do
Get
it.
her done.
Yep.
You can't do it.
So that's me. No one else
Okay.
has to share if they don't want to, but
I'll wait.
Okay.
I'm good too.
I'm good.
Okay.
We can.
I'm standy.
Okay. Listener inquiries. What has been your favorite episode of the podcast so far?
I was trying to think hard.
So was I. I don't know. Nothing. I don't think
Ooh,
any of
I
them
thought
like
of
really
something.
stick out to. Is that bad to say?
I mean, I think the ones that stick out are the like special ones.
Like the
So,
guest episodes?
a
or the-
guest one, the last drink one we did. We celebrated with a cake the 1 year anniversary of the podcast. Remember that?
We
Mhm.
weren't there.
That
so
was
that's not an
exciting. Yeah,
option.
sorry, no offense, but so things that we like made a big shebang
Milestone.
To do about.
Yeah,
Yeah.
but I do remember countless times where we end the podcast we're like, that was a really good podcast,
Yeah.
or that was really
Yeah.
fun, or that was good content. So
Yeah.
it's hard to pick out just one, but I do like our special ones like this.
Yeah,
Yes,
for
I
sure.
do too.
Mhm.
I did think of something.
Yeah.
It's not pertaining to my favorite episode, but it's kind of full circle. Do you remember that one episode? It was like you, me, we were sitting across from each other at the other studio with Bailey and someone else, and you were talking about Derek Shepard, and you were like, oh, you guys
Patrick
know.
Dempsey.
And Bailey and I were fangirling, and now we're gonna see freaking Patrick Dempsey at VMX. And I thought about the other day, and I was like, oh my gosh, full circle.
Yeah, isn't that crazy?
Yeah.
Mhm.
If anyone doesn't want to come see us, you can come see Patrick Dempsey.
Right?
But we're way better, so.
Better
That's
known
true.
as Derek Shepard.
Yes. Yes, exactly. I agree with you, Duckwall. I think all the fun episodes are the best ones.
Yeah.
Or the ones which I haven't been able to, like, I couldn't remember which ones they are, but the ones where I spend so much time laughing, I'm crying.
Yes,
Yes.
that's funny you said that, because I thought that
Ooh.
too. I was like,
And I
I
cannot
don't-
remember what.
there are certain ones where we were laughing and goofing off, and I think we're either really tired or really hungry or something. But
Yes,
Yeah.
and I would be crying because
Now-
I'd be laughing.
Yes. Now that you say that, one comes to mind. So we were at the old studio, and I don't know where I was sitting, but it was you and I, and it was one of our icebreakers. And they asked if you were like frozen in time. Remember we were talking about like standing with
Yeah.
your family members.
What?
I think I remember that.
I
You
haven't
guys
laughed
told me
that
about
hard on
that.
the podcast
remember
since
that.
then because we were dying. You
we
were
like,
there.
"This makes
It was
no
all four of
sense."
us, and we were talking about like us just like posing with our frozen family members.
I don't remember that.
I remember.
I
they
do
were-
remember that
they
now
were-
that you say that.
What's the fancy word of being the?
Cryogenically frozen.
Yeah,
Yeah, because you were
I
like,
remember talking about
You were
cryogenics,
inside,
but
and like we were on a tangent laughing, and then you were like, "How is this possible?" Like all serious.
no, and I was like actually deep.
They were just
Deeply
sitting
thinking
there, and her
about
and I
it.
just couldn't stop going back.
I must have just zoned
Oh,
out, and I
God.
was like,
you know what? The icebreakers were good for that. They
Yeah.
were good for making for
I did love the icebreakers.
making us.
I know. Maybe we
laugh.
can bring her back every so often.
Yeah.
Okay.
Oh shoot! Okay.
Yeah, that one was fun.
So I
That's a
didn't
good
really-
one.
That was a really good one.
I'm gonna
Okay,
I'm gonna
next.
chime in real quick because I want to say my favorite episodes.
Ooh.
I would say that my favorite episodes are the ones where, like you guys said, Mom's or Dr. King's laughing like so hard, and usually recently it's been from stuff that Devin says, which I think is equally.
I was
is
gonna say that.
Yeah.
And then I would say Dr. Levine's episode was great. I know it was a lot of hard work, but that is a very solid episode.
I was thinking
Um,
that too.
And then I would say the first episode, because the first episode was when I realized that when we all realized, I guess not Courtney and Devin, but I guess my mom, Dr. King and Duckwall, where we had something special, where we were like, you know, this is solid.
The chemistry, we're like, oh my God,
I
this is
amazing.
we can do that.
There was also
we're friends.
where like it obviously clicked for all four of us. Like we had a few episodes together, and then at some point we were just like, okay, we're just gonna carry on with this.
I know. Yeah. No, the
One
early
happy
days,
family.
it was always like exciting and kind of nerve wracking. Like I would get so nervous doing the podcast, and
I would also say, sorry, another favorite moment of mine, and this clip did really well on social media, was Duckwall and Courtney talking about if you would rather fight like 1,000 miniature sized horses or like 10 horse sized ducks or something.
It was a horse-sized cat and a cat-sized horse.
Yes.
Oh my God, yeah. We need to do more icebreakers like that. That's so funny.
Those were funny.
There was one funny episode. I forget who all was on it, but it was in the middle of like the old studio moving to here. And I think it was like me, Dr. Schmoke, maybe you were on it. And it was all four of our chairs just like crammed into a little corner.
Into the corner.
Just, like,
that was when the gym was in there and you guys had to, like, we were taking down the gym and you had to shove it.
You were all sitting there.
There was stuff underneath your guys' feet. And oh my God.
Yeah. We had to do a really close-knit one with Dr. Cross too, right? It was you, me, and him, and it was just like
sitting
very close together. And I don't know. Yeah. Thinking back, I feel kind of embarrassed about it, but we did it.
Yep.
Trip down memory lane on the 100th episode.
Right?
Great question.
Right?
Thank you.
That is a great question.
Yeah. Thank you, Anonymous.
Okay,
next one.
Yeah.
Hello, my name is Ariel. Thank you for the phonetically.
I was just going to say that's
She said
genius.
R-E-L.
Yeah, that's...
Appreciate it.
Yep.
I have just started at a vet clinic for the first time as a receptionist, and despite the odd social culture, I am absolutely in love. I am currently in the works of getting my undergraduate to hopefully get into Michigan State for vet med. I am in love with communicating with the clients, and I absolutely cannot wait to be a part of treatment plans for the patients. My question is, what are the qualities that make an exceptional veterinarian? And what are some helpful things that your receptionist does to benefit the team? Thank you so much, at Ariel.
Wow. Great questions.
Yeah.
Despite the odd
there
social
is always
structure.
going to be an odd
social
I know,
culture.
we need more
I'm
detail.
like, what is that? Like, I will say everyone in veterinary
That's
medicine's
funny.
weird, but okay.
Yeah.
Maybe that's the what.
Goofy, weird, kind of out there weird, but so fun.
We're not.
So fun.
But
No, we're
like,
not.
Yeah, okay.
Okay.
First
I
question.
wanna
An exceptional veterinarian, one that does not make messes. Just kidding. All jokes aside.
Nailed.
It's in their job
I
description.
think I'm a very bad veterinarian.
No,
I'm
you're
a-
not even the worst in the clinic.
I'm very bad.
No.
oh,
It comes with their job
I
description.
try my best to
Who do you think's
clean.
worse than her?
Dudley.
Oh, that's bad. Yeah. But you're a close second.
It's fine.
It's
That's
okay.
fine.
She's a great
You
vet.
should see my house.
Okay, anyway, sorry.
I would say decisiveness.
Yes. I mean, you have to have some confidence.
Mm-hmm.
But not too much.
Truly, like there's a balance there. I was
Yes.
just going to say that. You have to have confidence, but not overconfident. But you have to have a confident presence in front of your clients, especially when they're sad, scared, all
But
of
also
that
being
stuff.
able to like connect to them.
Yes.
And
Yeah.
sympathize and
I think that's the biggest thing I found, because that goes along with communication.
Yeah.
And
Mm-hmm.
so many owners that have a bad experience or went somewhere and they did not have a good experience or whatever, it came down to communication. They just need to be heard and validated. That's what it comes down to. And then, yes, it can really take up your schedule and back you up and, make you run behind, but you get it done.
Yeah.
You've always said it always gets done by the end of the day.
Mhm.
And that's what matters, is like the time in that room. So
for sure.
Yep. I think you have to like people.
Yep. Don't say you want to get into vet med because you don't like humans.
I know.
Yep.
If you don't like them, better learn to like them.
Yep.
Yes.
Yeah.
Let's see. What
Caring
other-
about your staff.
Yes.
Okay.
Like truly
Absolutely.
like caring about them and
Yes.
checking on them and making sure they're okay. Because I mean, as a vet, even if you don't have to be the practice owner, you don't have to be a part of leadership, but each vet holds that certain responsibility of their staff.
Mhm.
And so caring about your people.
Yeah. I think being a good team player, like if some of your colleagues are tied up and they need you to see their room, you say, okay, because they're eventually going to make it up for you too. And they're going to take your room or whatever, like being willing to step in and help. Or if like you're in surgery and you're drowning, call on a vet, call on a colleague and say, hey, can you help me with this? And even though they have 2 minutes before they have to go into their next appointment, you do it. Like you help them.
For sure.
So being able to ask for help.
Being able to ask for help
is good.
Self-motivated. I think you have
to be a constant learner, a freak or whatever.
Yes.
You have
and
to
I think
be
you
continually
have to
learning.
take accountability for yourself too, because there's so many ups and downs in the field that you have to be willing to take care of that and take a hold of it to show up.
Yes. Sure.
Yes.
Best of luck.
Best of luck.
She always just moves on. Like she swoops
Best
in.
of luck.
Best of luck to you, sister.
Bye.
Oh, gosh.
That was awesome. Okay, next one.
Okay, wait. She wants to know what she can do as a receptionist.
Look at her moving on.
To benefit the team.
To benefit the team.
The receptionist.
Man, they have the hardest job, I feel like. They get yelled at.
Field
Just
calls.
say yes.
Just say yes. Yes.
Don't be mad when we say that we're literally handling a patient, so we can't take a call right now. Unless it's an emergency. Please tell them that we'll give them a call back later.
I think that just scheduling things.
Yes.
Just saying yes, but scheduling it, putting it on the schedule, and then notifying the doctor team so then it can be arranged, quoted, whatever that needs to be done on then the next step. Because realistically, we're not in that room, but like the phone is probably going constantly. And at least at our clinic, we don't want it to go to voicemail. We don't want them to be on hold for too long. So just get the job done as best as you can and safely as you can, obviously, with making appointments, and then keep going.
I would say, like, you're there to serve the client, you know, so you should not, like, I caution people against being annoyed with the clients, you know, so, like, you're there to serve them. That's the entire purpose behind, you know, that position, is to serve them and make them feel welcome, because you're the first barrier. You're the first, like, exposure to the clinic. And so it can go a long way. So if they have a great experience with you on the phone, then you're already helping the veterinarian because you're establishing trust. So when the client's then in the room and the veterinarian is talking to them about maybe a procedure or a treatment or something that they need to, you know, weigh and decide, then you've further along down that road to saying yes, you know, to following through. So I think it's really important because you are the face of the clinic. Depending upon how your clinic is set up, you may be at a front desk where the people walk in. So you're the face of the clinic. So, you know, do you act annoyed when they walk in, or are you happy to see them when they walk in? You're there to solve a problem, their problem. So that is really, I think if you approach it that way, then it only benefits everybody.
Yeah.
And it sounds like she's going to be a great receptionist because she says that she's in love with communicating with clients, which is not common. So
That's awesome.
kudos to you. Still, best of luck.
Best of luck. Yes.
Getting into undergraduate and vet school.
Yes, absolutely.
You got it. REL.
Okay, next one. Okay, I'll do it.
Yeah,
Hey, it's Hadley again. Still live listening every Friday. I have 2 questions. What are your clinic's annual vaccine recommendations, i.e. what does a gold standard annual look like for y'all? In Georgia, rabies is a required vaccine, but lots of owners turn down our other recommendations. I ask this since the lepto vaccine is now considered a core vaccine in dogs. Have you always offered this to your clients like the parvo vaccine, or just now introducing it? Because I'm in Georgia and from the lower Alabama, we have always highly recommended clients get lepto. And then from Hadley, once again.
We always recommend it.
Yeah.
Always.
Distemper,
Yes.
lepto, Bordetella, rabies. That's our core. Yeah.
Yep.
Or that's,
I
I
guess
typical
Bort-
annual. Is Bordetella a core? Isn't it?
I don't think it's technically a core,
So
but
distemper, lepto, and rabies are core.
yeah.
But we highly recommend Bordetella. We have flu, Lyme as options. Am I missing any?
Flu and Lyme are the most optional.
Yeah.
Yeah, flus become more common because of the requirement from local
Boarding
daycares,
and-
boarding,
daycares,
groomers, all that stuff. I personally tell people the most common question I get about vaccines, ironically, is not what does the DAPP stand for? Because they hear parvo and that's like one part of it, and they're like, oh yeah, I know about parvo. But the most common question I get is what is lepto? And so I always say, well, I mean, it's in the environment. It's everywhere, pretty much. And it's also a public health risk because humans can get it. It can kill your pet. I mean, I don't want to say scare them or fear mongering or whatever that word is or phrase, but like it's true. It goes to the kidneys and it kills them, and then it can spread to people in your household. So I think it's a great thing that it's now a vaccine.
Yeah, absolutely. Yeah. I think, the annual visit for a dog at our practice would be like, obviously their annual exam, and then we typically recommend lab work. So they're getting a wellness panel run, they're getting a heartworm test run, and then we recommend
with the Acuplex,
40X. With the Acuplex, which is 40X. Yep. So and then a fecal, and then depending on if they're due or not, then they get the DAPP and lepto.
We have a lot of dogs on ProHeart 6 or 12 with Simparica.
Yep.
And the distemper part we're using every 3 years. So the DAPP we use every 3 years.
Yep.
And then rabies every 3 years.
Yep.
If it's applicable based on its age. But lepto, I automatically, I don't not recommend giving lepto. Oh, I think the only times that we'll have people come in and be like, I don't need lepto is because a breeder has said something.
Yes.
Yep.
Or it's always a breeder, a dachshund breeder, a little white dog breeder.
Yeah.
It's usually like that scenario. Like somebody's told me I shouldn't get this vaccine. And I will say back in the day, like when I first got out of school, lepto was responsible for a lot of vaccine reactions and whatnot, but they've redone the vaccines. And so I think we see less issues with it.
Yeah.
I do feel like there are still some kiddos that are like absolutely no lepto because they have awful reactions to it. But
I don't get a lot of
few and
there
far
are precautions we
between.
can take now. So
yeah. If there's any question, pain or any minimal swelling, we'll just pre-medicate them.
Yeah.
Which just Benadryl and a steroid both, one or the other, just depends.
Yeah.
Or anti-inflammatory.
2 little dachshunds that come in at like 7:30 a.m. We pre-medicate them, give them their lepto, and then we monitor them all day.
Yeah. Yeah.
Yeah.
We have a cat that we do that with rabies for.
Really?
Mm-hmm.
He's coming in tomorrow, actually.
Is he?
Well, what are the odds?
Well, I think
Are we talking about the same
accident?
Yeah. He's coming in tomorrow or Friday.
Oh, for
I'm not
the
kidding.
rabies.
Yes, I'm not kidding.
Wait, dose?
Yeah.
Isn't he evil?
Yeah.
I
He
think
just doesn't like us.
I didn't know you had to.
But Mom knows he doesn't like us.
Yeah.
No, but we can vaccinate him and then just
Oh, no,
watch
he's
him.
great for
I didn't
vaccines.
need to monitor him all day.
Yeah.
Well, he's only there
most
for
of the
like 30
morning.
minutes.
Yeah.
Oh.
He doesn't stay all day.
Huh.
Yeah.
That's
But
I
nice.
think
hang out
a
with
lot
him.
of times now we end up like saying, hey, these are small dogs. We always see
Yes.
pain.
Yeah.
People think pain is a vaccine reaction. It's not. It's a normal, thing that happens with vaccines.
Just like when you get vaccinated.
your arm hurts,
Yeah.
and some people like can't move their arm that other people are doing fine.
Yep.
Yeah.
But I think we got used to just saying, hey, listen, we're going to preemptively treat these guys with an anti-inflammatory.
Yeah.
And they seem to do fine.
Yeah. I also explain to my clients every time, or if like they're getting lepto, because yes, lepto is the main offender with vaccine reactions. But I automatically just explain vaccine reactions to the clients, and I'm like, if they're sore, that's okay. Like I just say, hey, vaccines were given here and here. Watch for soreness. They might be a little tender later, but that's okay. And so I just like get ahead of it before they're like, oh my god, my dog's screaming when I touch it.
Yeah.
Also.
Because
I say if that they're a puppy or a 10-year-old dog getting a vaccine for the first time, I'm like, just watch for this.
Well, Yep.
So.
Yep, absolutely. I think if they're not surprised, they always do better. The owner always does better. I think that if you're wondering to know, like, lots of owners turn down our other recommendations. Why?
Yeah, I was
like, what is the
gonna say
pain
that.
point? Like, is it cost? Is it they don't understand? So I think going back and re-educating, which is a great way to use social media for your area. You guys can get on there and talk about the different diseases that you're protecting against and why they're important to vaccinate for. And it's a great way of reaching just your local community so that you're educating owners and stuff.
Well, I know there's like great heartworm disease charts and stuff where it shows
prevalence.
The different prevalence and stuff. So it may be just eye-opening to some clients where they're like, oh my gosh, we live in this area.
Right.
I'm sure they have it for vaccine stuff and diseases, but
So thanks, Hadley. Thanks for listening every Friday. Live listening on
Yeah,
Fridays. It's pretty awesome.
That's amazing. At
Thanks
least
for
there's
bringing
one
it
listener.
Great questions, guys. Thank you.
Okay, don't forget about that text message feature for our podcast. You tap on the episode and whatever podcast provider you're using, look at the top where it says send us an inquiry through a text message here, and then send us a message. If you would like to be would you like us to shout you out on an episode, leave your name. Otherwise, it comes through as anonymous. Okay, case collections.
We're doing 2, right?
Yes.
You guys have one?
Nope.
All right. So,
That was at the same time. Oh my gosh.
Okay, well,
I can also think of one if I need
I
to.
have one from just yesterday. I don't have an answer to why it's happening, but it's interesting. So it's a new patient, new client, 9-year-old bulldog, English bulldog, female spayed, and she presented for multiple issues. So eye changes and not using her back end was what was reported. This owner was very upfront and said she had not been to a veterinarian since she was a puppy. So that's 9 years. Not on prevention, not up to date on vaccines. So I think it's interesting because instantly the breed, when they walk in, there's going to be more than one thing going on, usually. Mm-hmm. Usually you can guarantee skin is going to be a problem, right? Mm-hmm. So I go in and just start from nose to tail, and that's the best you can do. Anyone out there where there's just a lot of stuff going on that somewhat overwhelms me in a history, I'm just going to go in there and just start from the beginning.
Yep. Mm-hmm.
So instantly, the poor girl, her eyes were atrocious. They were super red. Classic dry eye. Thick gunk across it. Corneal edema, didn't see well. Yeah. And they said that was one of their main concerns. And looking at that, they said that she had always had some eye boogers, but it got thicker over the weekend. And so in my head, what the biggest part is you have to discern what truly came about out of nowhere and what was probably there for a longer time. And they just didn't know or didn't say anything. So that's one of the scenarios. The eyes were probably going on for a while. Mm-hmm. It was classic dry eye case. So, and then the other thing that was the main concern was that she couldn't use her back end. Well, truly, when we stood this dog up, we had to help her up. It was her right rear. She constantly was just leaning to the right. She couldn't put any weight, did not want to put any weight on her right hind limb at all. But the weird thing was she felt like she was positive deep pain, and she actually had a CP. So I was like, I don't understand what's happening. Is it orthopedic pain? Is it neurologic pain? I'm not quite sure. She literally acted like she couldn't use it. And so, and then her skin was really awful.
Bulldoggy.
It was awful. It was one of those where we had to wear masks because she smelled so bad.
Oh, wow.
And these owners were so sweet, and you could just tell they wanted to do what they could, but they were also very financially constrained.
Sure.
So this was another good example where I just had to go with my gut and prioritize diagnostics. And I said, well, the eyes, they look like this. We're going to just go with that because they can't afford to do any of the tests I wanted to do. The Schirmer tear test, eye stain, and tonometry. They couldn't do any of that. Mm-hmm. So then I'm like, well, she's not going to go anywhere or live long if she can't move. So we did x-rays of her right hind limb and then her abdomen back just to see if there's anything obvious. I was like, is her hip dislocated? But she was acting like that. Pain-wise, I should say. I still don't know. I'll be very honest. She had quite a bit of spondylosis in her lower lumbar region. She definitely had some osteoarthritis changes in her left hip and then in her right stifle. And she had some laxity in her right stifle with some stifle effusion. But there was no obvious fracture, dislocation, I don't know, cancer, neoplastic type lesion to explain why she literally just would keep leaning, she just didn't want to put any weight. It's like it wasn't there.
Was she blind?
Yeah. I think she could see maybe shadows. Maybe.
Okay, if that, yeah. But I saw her and she just had her back turned.
Yeah.
And she was just sitting there.
Yeah, she was. To be honest with you, I don't even know.
Blind or anything.
She's been like that.
Okay.
But I didn't do a full-blown ocular exam knowing that my options were very limited.
Sure.
Yeah. So that's all they could afford we did blood work. And blood work showed very mild increase in globulins at 5.2. But truly the CBC was pretty boring and everything else was boring. And I was like, well, crap. I was hoping that would help me in some way. She had a temperature of 103, but she was panting and just stressed being here or being there. So what did I do? Well, I said, I can at least say there's a lot of things I can rule out, but we're going to treat her with doxycycline. because tick-borne disease is on my list for weird neurologic stuff.
Mm-hmm.
Even though her CBC didn't look like anything, I did cephalexin for her skin. I did Rimadyl and gabapentin for pain, and I scripted out tacrolimus. And we went on GoodRx, and we tried to find the cheapest option to order or to get those to them. And I did bring up quality of life with all these issues, and I said the main thing is she can't move, like she can't even stand by herself. She's got urine scalding, like everything.
Oh, jeez, yeah.
And the eyes alone, like if it kept going, we can't treat it. It's painful.
I was gonna say dry eye is painful.
Mm-hmm. So I don't know. That was just yesterday. So we're gonna see tomorrow. He definitely said, he's like, I just need to try these medications, and then I understand we have to look at quality of life.
Okay.
I do not know what's wrong with that dog.
They were very sweet owners.
They really need to get an MRI. Probably is what I recommended.
Yeah.
But
Dang. Yeah.
And she was a hot mess breed.
That's just a breed that's just.
oh yeah.
They don't age well. And when the ball starts rolling, it don't stop.
Yeah.
Mm-mm. It's constant upkeep with that breed, and yeah, you need to get insurance if you have one.
Yeah, they're the quintessential
Mhm.
reverse ATM.
Please. Please.
Yep.
Yes, they are.
That's a good way to put it.
Yeah.
That's
Yeah,
funny.
absolutely.
Okay. King, what's your case?
I can talk about a case. You guys don't have one, really?
I want to do more digging. I don't have all the results for mine yet.
I could talk about a patient we had, but it's like more behavior kind of thing.
Archibald?
No. I don't want to
That's
talk
the
about
Great
him.
Dane, isn't it?
No.
No, it's a
There,
cat.
we do have
It's
an
a cat that
Archibald
wants to
Great
murder
Dane.
everyone
Okay.
in his path.
Yeah.
But mine's behavior. It's not really like a cool case.
Okay.
I mean, I've
I
got
can
my own
start
cat.
mine, but well, you don't have to talk about that.
I thought about it, and I was like, this is a really good case to talk about on the
I've never seen
podcast.
anything like it in my entire life.
Do you want to talk about it this week or next week?
Or never.
Are you prepared?
Maybe next week.
I mean, I'm prepared. I know pretty much everything about it.
At your own discretion.
you want to do? Can she do 2 cases?
Am I loud?
It is a good one, but just
Yes, she can do 2 cases if you guys don't have any.
sorry.
I just can't think of anything right now.
It's okay. This is God telling me I need to just get it out there.
Okay.
Because I think
Get
it
it
may
out there.
benefit people. Okay, so my beloved Walter was 10 years old. He was my first animal ever as an adult. Been there through lots of changes, lots of things. So very special in my heart. And
He's a cat.
What?
He's a cat.
He's a cat.
Sorry to interrupt.
Sorry, male neutered cat.
Sorry.
Indoor only.
Age.
Age 10.
10.
She said that.
Yeah.
Okay, sorry.
So I was one of those owners that I didn't want to take my cats in unless they needed their vaccines and blood work done because I would stress out. So I did routine, like, you know, I looked at him at home and then I would do the vaccines every 3 years, get blood. I did do blood work on Walter every year because he was my favorite, truly my favorite. And so Wednesday, a week ago, I get home. I'm with my daughter after a long day of work and daycare. She's sick. It just adds to the story. And we're sitting on the couch and I hear howling, like deep guttural howling. And I'm like, he's going to vomit probably. He's done this
Yes,
before.
mhm.
So I go over, he's in the corner. He's licking his lips. He's salivating a little bit. And I'm like, it's okay, buddy. Get it out. He's looking at me, meowed back at me. And I was like, get it out. So we go sit on the couch again. And then I hear it again. And I'm like, what is going on? And then I hear a thud. And Walter was over against the wall and he started panting. And then he fell over and went rigid and then sat back up and howled the most painful guttural howl I will never forget right after this episode.
Mm-hmm.
It happened every 45 seconds.
Oh, gosh.
And then he would pant. He would go, and then he would fall over.
Mhm.
He would go rigid. He lost his bowels every time. Urine, poop, whatever. And then he would sit back up. I would talk to him. And he'd move his ears like he knew I was there. And during an episode or two, I would see that he was like, had nystagmus. So I'm like, I truly in that moment, I was like, I don't know what is happening. Is it seizures or is it heart failure?
Mm-hmm.
Because in cats, it could just be so like
Sure.
similar. I had never heard a heart murmur on this cat. Like he had never everything. That morning I left for work and he was sitting in his empty water bowl like normal, looking at me because he wanted water. Mm-hmm. So these episodes kept happening. I called Courtney. I was like, I'm by myself. I'm with my baby. Or I was with my daughter who was crying. His cat is dying. And when I called her, he leaned back. So I thought he was going agonal. Mm-hmm. And she just came right over. And I was very grateful for that because I was like, I don't know what to do. And then I called our coworker, my lifelong friend, Kristen, who's still at the clinic. And I was like, this is happening. I don't know what to do. I can't get him to... I thought he was just going to die every 45 seconds. And then I thought I was going to kill him by taking him in the car. So then Kristen comes over. I was like, bring Lasix, bring a stethoscope, and bring euthanasia solution. Mm-hmm. And she was bringing diazepam because I didn't know what was happening.
Right.
And I just... As it kept happening, okay, you guys, I would have done anything for this cat. I have many, many animals. I would have spent... My husband and I agreed of all the animals... And this is probably wrong. We would have spent thousands and thousands of dollars on. It was this cat.
Right.
Yes. And he didn't give me a chance to do that.
Yeah.
Which is the most heartbreaking part of it all.
Yes.
And so as it kept happening, I realized in my heart, this is not good. This is nothing I can fix. Even if I wanted to know what happened, I can't get him to the clinic to do a chest x-ray. Like, I don't want him to die that way. And so then Kristen got there. She's a DVM. Listened to his heart, said there was an arrhythmia and she couldn't hear his left lung sounds. So there was probably fluid in his chest. And so then I knew. And we proceeded with euthanasia. Mm-hmm. The reason why I definitely wanted to share this case is not only is it interesting because we just talked about how cats like to randomly die.
Yeah, no kidding.
I am a veterinarian. I truly thought nothing was wrong with my cat. I took the best care I know I could have ever taken of my animal, and he just died.
Yeah.
Mm-hmm. So for anyone out there who have had these situations or for they've experienced it at a clinic or their own pet, try to have grace with yourself because sometimes it just happens and the body has something going on that they're hiding or literally is not a problem until it happens.
Until it's a problem. Yeah.
So I've played the what if game for the last week of like, what if it was heartworm? What if he had breathing all like dyspnea all along? What if he had a heart murmur and I never heard it? Like, was there something I could have done? What if I gave Lasix and he would have been okay? Mm-hmm. And he could have made it till my husband got home. Like, my husband was on an airplane, so I had to text him and be like, this isn't going well. It just was a terrible situation.
It was a horrible situation.
Yeah.
And I've never seen a cat like that in my 5.5 years of being a vet come in like that. And it was my own pet.
Yeah.
He went agonal every minute. It was insane.
Yeah, that's really hard to watch. And I mean, that was the kindest thing you could have done. Because otherwise, I mean, watching them do that for, until they pass on their own is just so.
I think that's what gives me peace now. It's this
Yeah.
far out of it is that I know that was the best for him. I'm just mad.
Yeah,
that was what happened.
Yeah.
I'm just mad that I would have given everything for that.
Well, and that's something that you hear clients will say, like, or we'll even say to clients and talking to them about pets that have serious problems that are unfixable problems. Some of these clients will be willing to fix it. If there was a fixable problem, they would fix it. And I think that's the hardest part is having an unfixable problem as an owner, and not being able to fix it.
Yeah.
When you would fix it,
Yeah.
And then not being able to or not being given the chance to fix it is a really hard place to be,
Yep.
But yeah, I think it's, the cats are just, gosh darn it.
And explaining it to my husband, he's like, I don't get how this happens. I was like, I don't
either.
There's no words to describe
We don't
it.
either. That's exactly right. Yeah. Yep. Cats are cats.
Walter was amazing.
My heart is on the table. Everyone be kind. But I'm good now.
I think that's great to share because I think people need to know that. And I agree completely wholeheartedly that.
You are much stronger than I am. I don't know how you just talked about that.
I'll cry later. I'll be honest.
It's
adrenaline right now. That's why.
Yeah.
She's a superhero.
I cry in private.
It's definitely changed my perspective.
Yeah.
Yeah.
Just a shout out to all the moms out there. Single moms, married moms. Because Duckwall was a superhero that night. Single mom and cat mom all at the same time. Anyway, we can move on now. Just want to give a shout out. Hi, I'm a longtime listener of the VRT, and I love listening to y'all's discussions. I currently work at a small one-doctor GP, and I'm considering making the switch to a multiple-doctor urgent care/ER. I was wondering if there were any tips on how to make that transition, as this GP has been the first clinic I've ever worked at. I'm excited but nervous to make the change. Thank you.
Oh, God.
That is
buckle
a
up.
loaded question.
I said, when I read that, I was like, oh, boy, buckle up, baby.
That would be quite the change.
But change is okay.
Change is good.
Change is okay.
Change is
But
inevitable.
get ready to shift gears.
So my famous quote, not mine, somebody else's, change is inevitable. Growth is optional.
There you go.
Just keep saying that every day you go in and you're thinking, why did I do this?
Honestly, I read that and I was like, there's going to be multiple doctors.
Yeah.
You
Actually-
got this.
Yeah. Actually, and you're going to have people that you can rely on, hopefully,
Yeah.
to ask questions.
Yeah.
And keep it simple until it's not,
Yes.
is what I
Yes.
would say. Like when you're practicing.
I will say, it sounds like a fun change.
I'm assuming she's a tech.
Action.
Yeah.
Oh, yeah.
I'm assuming.
Maybe. I'm gonna go. She's a tech.
Yeah.
That's just my take. Maybe if you haven't, or I don't know if you have yet, but maybe just go like shadow and just see really what you're getting yourself into before you fully make the commitment. That might be helpful too, just because it
Yeah.
is a really, really big change.
Maybe take like a week off in between jobs to get sleep and
Yes.
fuel up, and then just get ready to hammer it.
Yeah.
I think you have to reframe your goals and your mindset because there's different goals for GP versus ER.
Mhm.
ER, you're very much stabilized, treat and
Triage,
street.
yeah.
And
Yeah,
then,
you don't get to follow the case.
Yeah, you don't know what's happening.
Mhm.
And
Get some
usually,
good
like,
shoes.
what's that?
I said, get some good shoes.
Yeah, get some good shoes and enjoy the adrenaline. Hopefully,
That's a really good. That's a good tip.
Embrace the
what you just
grind
said.
and the
I
chaos.
think you have to. I think you have to self-reflect if you like adrenaline or not.
Yeah.
And then down times, it's like really high and then really low. I'm pretty
Uh-huh.
sure that's what I've heard.
Yeah.
I don't know.
Surges.
Yeah,
I think you will become
That
a
does sound
very good
exciting.
technician.
Yeah.
Very good technician.
When you read it,
skills.
what made you think it was a technician?
Just because she's. I
don't
feel
know if
like
they have veterinary assistant, like I don't know, an assistant role in an ER.
she just said,
facility.
I work at small one doctor GP and I'm considering making the switch to a multiple. Like she's just talking like she works with one doctor.
I don't think she's a doctor
I don't know though.
because she works at a small one doctor. I feel like she would say that she is the doctor at.
Also, I love it. Could be a man.
We just call
Oh,
him.
you're
Sorry,
right.
Yeah.
Sorry.
It's
We do that all the time.
I think it's funny because that's what
Yeah.
our profession is.
Yeah.
Literally.
They.
If you are a receptionist or assistant that
Yeah.
is more on the client side, get ready to field some calls
Mm-hmm.
and work on your phone etiquette and has to deal with very stressed clients.
I think that's the most stressful time.
Yeah.
Yeah.
And clients will show you're crazy. They're
Mhm.
crazy.
And just know it's not you. It's usually something else that's going
Yeah.
on in their day, the stress of the situation, the stress of
Mm-hmm.
it's never you.
Mm-hmm. Maybe have I feel like this is a big one, have the emergency fee or whatever, like the baseline charges. So you
Yeah.
can tell them that over the phone so they don't get there and then get super angry when you tell them that in person.
and communication because there's going to be wait times.
Mm-hmm.
So whether you're with you're in the CSR stat, what is it? CSR? The
Mhm.
Client service representative?
Yeah.
Mhm.
Okay, so if you're in that category or if you're a technician or you're a DVM, I would just start to try to make it a forefront that the time is going to move faster for you than it is for the client. And you need to keep that in the back of your mind because most of the clients that come back to us are ticked because they waited
Mhm.
for hours
Yeah.
without any update.
Yes.
So you have to
Yes.
have some sort of recognition, it's been this amount of time for me. It felt like 10 minutes, but it's actually been 2 hours.
Mhm.
I don't know.
And that happens.
Set a timer on your phone.
yeah.
Yeah.
That's a
That's
good
sure.
tool.
That's a
Because
really
people
big
don't
thing.
mind if they are given the choice.
Yes.
Yeah.
It's always when they
Yes.
feel like they've been held captive
Yeah.
that you get that anger.
Yeah.
Mhm.
You know what? They may have very well chosen to sit there for 2 hours. If you gave them that option, like, hey, listen, it might be 2 hours. They might be like, okay, sure, no problem.
Yeah.
But if they weren't given the choice, even though they might have chosen it anyway,
Yeah.
then they get angry about it.
Yep.
Mhm. Or be like, hey, we're getting so and so set up on fluids and set in for the night. We'll send you a picture and an update here in a little bit.
Yep.
Just so they know what to look forward to.
But that's awesome. And great job going out on a limb and trying something different.
Yeah.
And just because you try it doesn't mean that, you
have to
know,
stay in it.
you have to stay in it. Just be resilient, and
It's a different type of skill set.
yeah.
Mm-hmm.
And if it doesn't work out, you move on to the next thing.
Yeah.
Go back to the GP, do whatever.
True.
But
Yep.
You're not
that's
stuck.
awesome. Yeah.
You can
Good
do what you
luck.
want.
Fun. I wonder where she's at. If it's in like a big city or
I know. That'll also play a big role.
yeah.
Very exciting. Let us know how it goes. I want to know. Give us
Yeah.
an update
I
once
know.
you've made the switch.
Anonymous.
Anonymous us back.
Anonymous.
Okay. Thank you so much for tuning into another episode of the Veterinary Roundtable. Remember, send in those questions and leave us a review if you enjoyed this episode or a previous one. And if you're attending via Max, make sure you buy tickets to the Veterinary Roundtable live at Old Red through the link in the episode notes or a social media page. We'll see you next week for another episode of the Veterinary Roundtable.
Or in
Thank you.
Orlando.
Woo!
Happy 100.